At the ASCO meeting, we presented our data using a network meta-analysis comparing the efficacy of covalent BTK inhibitors in relapsed CLL. As we know, we have 3 drugs, Ibrutinib, Acalabrutinib, and Zanubrutinib. Acala versus Ibrutinib and Zanu versus Ibrutinib have been compared in head-to-head clinical trials. We don't have data on the comparison of Acalabrutinib versus Zanubrutinib. So there are indirect ways of making those comparisons. One example is MAYAC, or matching adjusted indirect comparison. In this analysis, we used a network meta-analysis, which is a technique that you can compare different interventions and combine direct and indirect comparisons when you have more than 3 interventions. So here we used the data from Alpine trial, from Ascend, and from Elevate-RR. And what the study showed, we looked at the overall response and CR rates. In terms of overall response, Zanubrutinib was superior to Ibrutinib for overall response, and that was statistically significant. The difference in terms of CR was not statistically significant. In terms of Zanu versus Acala for overall response and complete response, we did not detect a significant, statistical significant difference, although numerically the numbers were in favor of Zanubrutinib. For progression-free survival, we did 2 types of analysis, adjusted and unadjusted for COVID-19 related deaths. When we looked at the high-risk population defined by each study, and after adjustment for COVID-19 related deaths, the Zanubrutinib treatment was superior to Ibrutinib, to Acalabrutinib, and to chemoimmunotherapy, and that efficacy advantage was persistent regardless of adjusting or not adjusting for COVID-19. When we limited our analysis to patients with DL17P, again, Zanubrutinib was superior to Ibrutinib, Acala, and chemo in the adjusted model. But when we, in the unadjusted model, there was no difference in terms of efficacy from the PFS standpoint in DL17P between Zanubrutinib and Acalabrutinib, but Zanu was superior to Ibrutinib and chemoimmunotherapy. And lastly, when we looked at overall survival, despite some numerical trend, there was no statistically different OS between the treatments. So overall, we would like to remind ourselves that the first and gold standard of evidence would be head-to-head randomized trials. In the absence of direct data, we look at analysis like this to inform our investigators, clinicians, and hopefully patients in treating patients with CLL.